Hi, it's Dr. Mandy Reese with Reese's Pieces Diabetes. This is kicking off our CGM Bite Size series. In this segment, we'll be looking at an introduction to continuous glucose monitors. The components of a continuous glucose monitor. The first part we want to look at is the sensor. The sensor is the part of the continuous glucose monitor that is under the skin that is measuring the glucose in the interstitial fluid. The transmitter sits on top of the sensor, and this part it can be reusable or disposable, and it's going to connect to the sensor and it allows the system to transmit glucose readings to another device, whether that's a reader or a receiver or a person's smartphone or mobile phone. And then you have the receiver or reader, which is the device that's going to actually receive the data. Looking here, we can see, and it's important to think of what is the difference between continuous glucose monitors and blood glucose monitors. So if we look here at the graph, we can see, as notated by the points, these black dots along here, that is actually blood glucose readings. So if a person was checking their blood sugar and basically doing finger sticks, you could see based on the five dots that are in the green zone, it would look as if their blood sugar was, in range. It was doing great. But what we would miss if we were just doing finger sticks is we would actually miss beginning at midnight to the early morning hours where their blood sugar is above range. And then in the afternoon, we can see between about 12 and 3 here that their blood sugar is actually low. So we would the person wouldn't know that they actually were having hyperglycemia in the early morning hours, and they wouldn't know that they had hypoglycemia in the afternoon. And the value of the continuous glucose monitor, as I like to share with folks, is, doing finger sticks. Actually, had a conversation with somebody last weekend. And I said, finger sticks are like taking a picture with a camera. You get shots in time. Well, with continuous glucose monitors, you're actually getting a continuous sort of video of actually what's happening with the glucose. So then a person can make more informed choices in their self management living with diabetes. And then also for the person with diabetes and their healthcare provider, making decisions around how do we adjust therapy. So you may be thinking, well, who are candidates for continuous glucose monitors? I'm sure you're thinking about that now. Historically, we thought of folks who were taking multiple daily injections of insulin, so more than one injection per day. We now know that CGMs are of value even for those taking one dose of insulin per day. Those using insulin pumps, those who are experiencing low glucose or hypoglycemia, whether they're experiencing it numerous times or they're having situations where they're having something called hypoglycemia unawareness. So their blood sugar drops, but they aren't aware that their blood sugar is dropping. A person that's having a high degree of variability, so the blood sugar is going up and down, and sometimes that can even happen with hypoglycemia if a person overtreats. And then those who are having difficulty achieving their glycemic goals. So these are all candidates for continuous glucose monitors. So when we think about categories of continuous glucose monitors, the first grouping to think of is personal versus professional. Personal just simply means the person with diabetes owns the device. It's theirs, they've purchased it. Professional is owned and by the health system or the clinic, and it's applied in the clinic, and then the person will come back and have it removed in 10 to 14 days. The interesting thing with professional continuous glucose monitors is it could be blinded. So the person with diabetes isn't going to see what their blood sugar is, or it's not blood sugar, but their glucose is. And then unblinded is the person's able to see their glucose values. Integrated CGMs are CGMs that can be integrated with other digitally connected device. So whether that's an app, it's an insulin pump, it's the smart pen caps that we have available on the market. And then the next category to think about is real time versus intermittently scanned. So real time is when the values, the glucose values, are being transmitted and they can be measured and displayed continuously. And so some examples of CGMs, and we're going to look at some commonly used in primary care, would be your Freestyle Libre 3, your Dexcom G6, your Dexcom G7. These are all real time continuous glucose monitors. When we look at intermittently scanned, these actually do check the glucose continuously, but they require scanning for visualization and storage of the data. The CGM currently on the market that's intermittently scanned is your Libre 2. So as we think about all of these different options that are on the market, there are more than just these that are pictured here on this slide. So I wanted to bring that up. I chose these because these are the ones that are most commonly used actually in primary care. So of the ones here on the slide, all of them except for the Libre 2 are considered real-time continuous glucose monitors. So in other words, a person can see their glucose continuously on whether it's a receiver or if it's their mobile device that we're looking at it. Now, the good news is they get the blood glucose every minute with both of the Freestyle Libre systems. With the Dexcom, it's every 5 minutes. And all of these systems have low and high alerts built into them. The Dexcom's a little bit different for the G6 and G7 in that it has predictive alerts. So it lets the person know if they're headed towards, going to be having a low glucose soon. No calibrations are required with these particular devices. The Libre, in terms of being able to see the data, the Libre 2 has a reader as well as a person can use their mobile device. The Libre 3, right now, at this point in time, is only with the mobile or the smartphone. And then for the Dexcom G6 and G7, it's receivers and then smartphones. In terms of being FDA approved for dosing for insulin non-adjunctive, so in other words, you don't have to do a finger stick in addition to the value that you have on your continuous glucose monitor. All of them are FDA approved for dosing. And then warm-up period, it's changed over time. For our Libre systems, it's 1 hour. For Dexcom G6, it's 2 hours. And big news with the G7, it's only 30 minutes. And you can see the drug interactions listed here on this slide in terms of the agents. For Libre, vitamin C, more than 500 milligrams a day, and then hydroxyurea for the Dexcom system. In terms of duration for the Libre system, it is 14 days. There was a recent change with the FDA to allow up to 15 days with the Libre system, and it is 10 days with the Dexcom system. Some information I don't have here on the slide that I think is worth noting is with the Libre system, the size has decreased from the Libre 2 to the Libre 3. And then for Dexcom, this was a big change. So the G6 and the G7, there are some differences. Certainly in size, the G7 is smaller, but the biggest change is the sensor and the transmitter are in one with the G7. They're two separate components, the sensor and the transmitter for the G6, but the G7, it's all in one. And one interesting sort of customer feature is kind of what I would call it for the G7 is the overpatch is actually included with the sensor. So kind of interesting that the little added extra touch with the G7. And I wanted to show you a picture. I don't know about you, but I love pictures. I think they're worth 1,000 words. So here, actually want to show you on the top left here, we can see this is the Libre 2. Next to it, to the right, is the Libre 3. And you'll notice it's actually a smaller size from the Libre 2. You'll also notice there's not a receiver currently for the Libre 3. On the far right is the Dexcom G7. You'll notice that it does interface with Apple Watch. There is a receiver with the G7, which you can see on the bottom right. So they've got the receiver, the sensor, and the transmitters all in one. And then you can see what the screen looks like on the top right for the G7 on the G7 app. And then in the bottom left, that is the Dexcom G6. Again, a receiver, you have your transmitter and your sensor. This is the insertion device, which has actually gotten much smaller with the G7, and then the screen for what it looks like. Now, with the G6 and the G7, they did change the G7, the app on the smartphone to really incorporate your ambulatory glucose profile report into the main screen for the G7 app. So that is one change. So a person can look at their time and ranges without having to go to the Clarity app with the G7. So it's actually built into the G7 app. This is for me, I put this together, some things that I think about when I'm working with a person with diabetes to think about what is the right CGM or continuous glucose monitor for that person with diabetes. First and foremost, it should be shared decision making. That person with diabetes should have their voice heard. I prefer folks to give them information, have them go home, chew on it, talk with their loved ones about it, and then come back and we'll have a discussion. I provide educational materials, links to videos, and then come back for a follow-up visit and decide what's going to be the best CGM for them. Certainly, level of comfort with technology. Particularly, I always like to check during the visit if the app, whether it's the Libre 2 app, Libre 3 app, uh, G6 app, G7 app, I like to see what's available on their smartphone so that can tell us what choices. I certainly know for a Medicare patient, they're going to need a reader or receiver. So it's going to be the Libre 2, the Dexcom G6, or Dexcom G7 are going to be my choices. If somebody has an Omnipod insulin pump, a T-Slim, or Tandem insulin pump, it's going to be the Dexcom G6 because currently that's the compatible CGM for that system. Ability to share data, particularly with older patients, their kids, and nieces, nephews who are helping them with their healthcare needs. I certainly want them to be able to share data. And then preferred wear sites. All pretty much all of them, except for the G6, can be worn on the arm, and a lot of folks like that. But if somebody prefers the abdominal area, then the obvious choice is the Dexcom G6. So this is the end of the introduction to CGMs. More to come in this series. Thanks for joining. If you do enjoy this video, please share with others. We want to get the message out, and make sure to follow and to subscribe to Reese's Pieces Diabetes. Thanks so much.